20 doctors, that we take some leaves every month, every year, Holi, Diwali, Christmas we take, because that time people don't like to discuss health issues.
Yes, you want to enjoy.
Or at least forget about everything else. So
Correct. Forget the miseries in life and enjoy.
hello and welcome to Health Live at Seniors Today. We are delighted to have here with us once again Dr. Savita Bhat. And before I continue further, let me introduce her to you. Uh, Dr. Bhat has been, uh, a very leading ophthalmologist, and she is a senior consultant in glaucoma, cataract, and medical retina at the Chelarams Hospitals, Diabetes Care and Multi-Speciality. This is in Pune. She completed her MS in ophthalmology from the famous Christian Medical College in Vellore and worked as a consultant at the Giridhar Eye Institute after her medical retina fellowship. She's published extensively in the field of glaucoma with several publications in leading journals, including the American Journal of Ophthalmology and the Journal of Glaucoma in the US. She's contributed articles on diabetes and books. She's won the best research paper awards at the national and state levels on 5 occasions, including the best neuro-ophthalmology research paper at the national level in Jan 2000, and the prestigious Shiva Reddy Research Award in the year 2009. She is, apart from a regular practice, she's participated in various clinical trials, and we are privileged to have her here with us, speaking about diabetic retinopathy. Welcome once again to Health Live at Seniors Today, Dr. Bhat.
Thank you so much for your fantastic introduction and your kind words. And I'm glad to be here once again.
Thank you. The video that was there earlier, I was looking at the video, and you were there in it, as well as a couple of other doctors from Chelarams who have been with us, and we're looking forward to more people to come
Joining
over and advise our readers and viewers here. Over to you, Doctor. So the subject that we have discussed today is diabetic retinopathy, and this is on the basis of several requests that we've received from our viewers, from our readers who attend our sessions. Sometimes when doctors are late, we ask them what they want, and then make a note, and because there are OPDs, etc., and obviously surgeries that happen. So we ask our attendees what they want, and diabetic retinopathy was much in demand. As you can see, we have around 200 people already on the live attendees, as well as a lot of people who are attending it live on YouTube. So there is a fair amount of interest in the subject. I have received a few questions already. So first, over to you, Dr. Bhat, to make your presentation, and then we will take questions from people.
Sure. Can I start sharing?
Yes, please.
Is my slide visible?
Yeah, I think you can make it full screen if possible.
Full screen करना है इसको.
Yeah, now it's fine.
Wait, Sky. Yes. Am I audible?
Yes, you are audible as well.
Yes. Good evening, everybody. I would like to be, I'm Dr. Savita Bhat, and he's already introduced me, and I would like to be speaking on diabetic retinopathy today. Before we embark on the journey of understanding diabetic retinopathy, let me briefly explain how the eye appears and how the eye functions before we actually go into the nitty gritty of diabetic retinopathy. So, as you can see from this photograph, this is how the eye appears to us. That is the upper lid, the lower lid, and the bluish structure that is called, which imparts the color to the eye. The central black portion is the one is a window which lets the light into the eye, and it also lets the structures or different objects that we see, it lets it allows it to form images. That's a central black structure inside, and it is regulated by a structure called iris. This is how the eye appears to us. On the right hand side picture, it shows the cross section of the different layers of the eye. We'll come to it on the model. Now, can I get back to the video, please? So this is how the eye appears. It is like a round ball. It functions like a camera. Now, if you can see, the structure of that football is getting focused through the light rays into the eye. The red and blue lines that you see is the retinal blood vessels inside the eye. Now, whatever you see gets focused onto one particular area of the retina. However, the retina is an entire structure which is like a entire surface area. I would like to stop sharing and go on to the model of the eye before I continue.
Yeah, you can go ahead.
Yeah.
Yeah.
Can you stop sharing so that I can show them the model of the eye, and then I'll continue with my presentation?
Yeah.
I'm not able to stop it from here.
Firoz, can you do that? Just give me a second.
You can see me now?
Yeah, I can see you now. Yeah.
So this is how the eye appears. Unless I explain it to you on a model, possibly you will not be able to understand. Are you able to see me? There is something else on the picture. Yeah.
I'll be able to see you.
So I'm sorry for that. So this is the model of the eye. This is how we look at the eye. I'm sorry if that front portion falls off. This is the upper lid. I'm holding it with my hand, upper lid, lower lid, white portion, and the black portion, which I showed you on the video. Now, inside the eye, if you break it open, you find different structures. Now, first amongst these is a cornea, the transparent structure, which is present above the black portion, which imparts color to the eye. Are you able to see it?
Yes, we are able to see it.
Yes. So inside is a crystalline lens which gets foggy and you can get cataract. We are not talking about the cataract. We are not talking about the cornea. We are talking about the back portion of the eye, the retina. So this retina is an entire surface. So this retina, if you have any image, if you see a pencil or a pen, it gets the image gets focused onto one area only. But the retina is the entire surface behind over here, and the retinopathy can get affected in the entire area over here. So irrespective of your vision can be absolutely normal, but the retina can get retinopathy at the back at various stages. So this is what I wanted to highlight. I will go back to sharing my slide now, and I'll explain briefly what exactly happens in retinopathy. So in diabetic retinopathy, it is very truly said that eye is a window. Are you able to see my slides or?
Yeah, but you just need to make it full screen.
Yes, sure. Right. So in diabetic retinopathy, the small blood vessels inside the eye and the nerves get affected, causing different leakages. So it depends on what stage of retinopathy you are at or whether you have one or not. And depending on that, we call you for review, screening, and if required, treatment. So before we embark on retinopathy per se, this is how a normal retina appears. The central black portion, this is the structure of the right eye and the left eye. I won't go into the nitty gritty of it. There is some black portion appearing on your left hand screen. That is the center of the eye where you get perfect images. The round ball like structure is the optic nerve or the nerve which connects to the brain and tells you what you're viewing. Are you looking at a basketball? Are you looking at a pen? What is the color of the pen? That message is relayed through the optic nerve. The red lines that you see are the retinal blood vessels. You can actually view them. You can actually see what is happening to them, whether they are leaking, whether they are clogged, whether they are functioning properly. We can even see, do angiography, push some dyes into these vessels and take pictures and see whether they are functioning properly or not. These are retinal blood vessels. When they get damaged, likewise, you can also see what is the amount of damage, what is the quantum of therapy that you require. So, just to explain in more detail, I just picked up one picture of the right eye fundus, the central black portion, the most important for our vision, the round ball which I was mentioning, and all the red lines which are going all across are retinal blood vessels which are crisscrossing into the eye, supplying different layers of the retina. Now, these are the stages of the retina. We don't require the nitty gritty. Basically, the diabetic retinopathy can be classified into two groups. It is called non proliferative diabetic retinopathy, which is less sinister, less harmful, and the more sinister one is the proliferative diabetic retinopathy, wherein your original retina, which is provided with the retinal blood vessels which you are born with, are completely destroyed and they are replaced by either fluid or blood. And the retina is actually hypoxic, it is asking for more nutrition. At this stage, the body tries to repair itself and throws in new blood vessels. When it does so, the new blood vessels are not strong. They are weak, they usually bleed or they burst. So, that is a stage called proliferative diabetic retinopathy. I have a small video which I picked up from the net itself, and I would like to show you that. This is the video. So, diabetes can cause cataract, glaucoma, and diabetic retinopathy. Once you peek into the eye, you'll be able to make out whether the person has diabetic retinopathy or not. We generally would like to dilate the eye so that we can have a complete view of the inner eyeball, which I described in my structure. A preliminary examination can be done by hands on different scopes. I told you there are two stages, non-proliferative diabetic retinopathy and the more sinister proliferative diabetic retinopathy. The non-proliferative one will throw small balloon-like structures of the retinal blood vessels. If it causes leakage within the complex structures of the retina, it can cause edema and the vision can come down. The most important complication happens when the leakage are more far and wide and it involves larger surface area of the retina. If it involves the area called the fovea, which is focused over here, it can cause leakage, macular edema, fluid collection over there, and the normal fovea can have fluid collection and the vision can go very much down. And that is the stage when the patient starts using magnifying glasses and his vision is impaired. This stage can come in at a much later stage in diabetes. It can be treated with painless injections and laser. So this is the damaged retinal blood vessels with the yellow structures which you can see. When a wide portion of it gets damaged, it throws new blood vessels, which is a hallmark of proliferative diabetic retinopathy. These new blood vessels, which are thrown as reparative structures, are extremely weak. They easily bleed, and earlier we would say that even with kickstarting a bike or a scooter, you could bleed into the eye. How do we recognize them? You get these blotchy floaters in your view. We can see it on in and around that swan which is going around, or you can see a reddish tinge if the blood is there, and it is treated with laser and again injections. If it worsens further, the retina can get pulled, it can get damaged, and the retina can get further detached. This requires a more severe form of therapy. So coming to the stages of different retinal retinopathies. So in amongst the non-proliferative diabetic retinopathy, you can just have few findings like those blotchy red spots on the retina. It can worsen, the leakages can get far worse, throwing some cholesterol-like substances where we call it moderate. In this, the lesions are far more wide, and we can group it into severe and very severe non-proliferative diabetic retinopathy. When extensive amount of retina is damaged, it starts throwing reparative new blood vessels which eventually bleed, destroy the retina, pull on the retina, tug on the retina, and finally get destroyed. One should not wait till the retina gets damaged. Unfortunately, the initial stages of retinopathy are fairly asymptomatic. The patient does not know. That is why we emphasize, even educate people that if they have diabetes, do come for a follow up of the eye diseases, and do look into your complications and not just your sugar control. So I was just talking to you about how to evaluate retinopathy. The time-tested way of evaluating retinopathy is looking at how many of your quantum of blood vessels are clogged. The routine examination done for this all over the body is angiography. All of you must be aware of the heart angiography. Similarly, we have eye angiography, which is done by injecting a dye into the arm. It goes all over the body, so also into the eye, and the eye starts showing structure like this. If it is normal, you don't get these small dot-like structures. If you have the retina affected, you will get these white dots which are affected because of the retinopathy. The glow on the side, the white glow that you can see on this picture is because of the new blood vessels. They are leaky. They are not strong like the normal blood vessels. So this is how it appears. Now, because of the advent of something called OCT or optical coherence tomography, which is an in vivo histological cross section of the retinal 10 structures. We can do it in vivo. Generally, it's done as a histological examination. We can get to know whether the retina is edematous, has got fluid, or is looking normal. The first picture that you can see of a black and white structure next to the instrument is a normal retina. The second picture is that of an edematous damaged retina. Now, I've just made this picture. On your left hand side, the first picture is a normal retina, normal cross section of the OCT. As you see, of a person, of a woman who looks from the center. And if you look at the bottom picture, you can see that the retina is affected and you can see those tiny yellow spots. If you take a cross section of this picture on the OCT, you can see it fluid filled or like a mountain of fluid over there. So OCT is basically you're viewing the eye from the side, or you getting a cross section of the eye. So we treat it with laser. Laser is nothing but light amplification by stimulated emission of radiation. You're basically photocoagulating the retina so that it doesn't keep on sending chemical substances or VEGF substance, which tells you the retina is damaged, it lacks nutrition, sends some more nutrition, that eventually builds up more new blood vessels. So this is a lasered retina as against a normal retina, and this is a fresh laser mark. Now, there were some people ask us whether if you do good control of sugars, will you ever require, will your retinopathy reverse? So, this is a good example of one of our patients who had retinopathy, the right and the left eye on the top pictures, which got pretty well controlled after her sugar, blood pressure, cholesterol. All of it came down within 6 months. However, the vision did not improve as much because the damage was pretty severe in the center of her eye. I just brought in this picture to show you how important the control of sugar is for controlling complications of diabetes. This is another patient who has undergone therapy with laser and injections in the past, and over a period of 4 or 5 years, this is how retina looks. That on the on your left is the right eye pictures, on your right is your left eye pictures. So this is how the eye appears. So I would like to straight away take up questions. Thank you for your patient hearing. I don't know how much of you understood it or how much.
Much. Thank you very much, Doctor. If you can just close the
Yes,
presentation.
I have. Yes. Yeah.
It hasn't closed yet. Feroz, can you close it, please?
It's not close.
Yeah, now it's closed. Thank you. So whenever we announce our sessions, some questions come in. So and some of them you've already addressed, but this is a question: if my parents had diabetes, should I be
Yeah.
guarded against diabetic retinopathy, even though at 61 I'm having no trouble?
Yeah. So this is exactly why I explained the structure of the eye.
Yeah,
So people think if their vision is good, they will not have diabetic retinopathy. There's no need to evaluate. However, the eye structure is like a inner surface of an ball, only the center where you can see clearly caters to the vision. That area may be normal for a very long time. However, the rest of the retina may be involved in a very grotesque or a very advanced stage of retinopathy. So it's very important to undergo an eye examination at the time of detection of diabetes. Never, irrespective of your parents or you having good vision.
right.
It's
We have
not just with blurry vision that one needs to go to the doctor.
we have a question from Sunita Verma who's saying, my friend is not diabetic, but she still got this. She has to take injection in the eyes. Can high blood pressure cause retinopathy?
Yes, the high blood pressures can also cause high blood pressure can cause something called vascular block. Basically, these are pipelines which carry blood. The pipelines can get clogged. It's the example that I usually tell is the pipelines of your municipal water supply. If it gets clogged, you don't have water in your houses. Similarly, if the pipelines within your body does not supply the blood required at a very sensitive area of retina, the vision stops. So it requires to be treated very urgently.
Um, this is you touched about a bit on this, but Anupama Singh asks, can diabetic retinopathy affect other parts of the body besides the eye?
So diabetes itself can cause two kinds of complications. One is the macroangiopathy, which we call, which can affect the heart. Therefore, you have to undergo a evaluation of your heart condition as well, peripheral artery disease condition, thyroid, etc. The other group of diseases which it can affect is microangiopathy, that is small blood vessels inside the body. The small blood vessels present inside the body are inside the eye, inside the nerves of the hands and legs, and also inside your kidney. And they are termed as diabetic retinopathy when it affects the eye, diabetic nephropathy when it affects the kidney, and diabetic neuropathy when it affects your hands and legs. Would that suffice?
Yeah, that's fine. Uh, you of course touched upon the early signs of diabetic eye disease. Uh, at what stage of diabetes, again, you mentioned this, but what stage should one start beginning regular eye checkups?
At the time of detection, actually, they say for type 2 diabetics, at the time of detection, there is a reason for that. When you're detected to have full-fledged diabetes, type 2 diabetes, that is, when you're detected to have that, you would have undergone some 4 or 5 years of being pre-diabetes. And in diabetic retinopathy, the risk factor is not the level of sugars. So people think if their sugars are 350, surely their eyes are affected. It is not so. It is a number of years that you are having diabetes that that causes or has a higher risk of having complications of diabetes. So 5 to 10 years of diabetes can surely result in complications of diabetes. So at the time of detection of type 2 diabetes, you have already completed 4 or 5 years of pre-diabetes. That's the reason why we all say at the time of detection of type 2 diabetes, which are treatable, you require to undergo eye screening. Whereas for type 1, at least abroad, they wait for a couple of years before they undergo these examinations.
Right. There's a question that has come in. Is there a specialization of an ophthalmologist that one must look for, that an ophthalmologist should have?
A medical or a surgical retina specialist. Generally, all ophthalmologists will do justice and will look through your diabetic retinopathy stages. But if one is available, the medical retina or a surgical retina specialist.
We have a question from Savita Agarwal who says, if somebody is not diabetic, even then, can retinopathy affect? I have had rheumatoid arthritis since 16 years. Will it affect my retina?
Yes. The problem is rheumatoid arthritis. They used to treat it with a certain tablet called hydrochloroquine, HCQ, which is also used in diabetes. Recently, earlier they used to use it only for rheumatoid arthritis. That can affect the center of the eye called macula, and you can have vision loss and early signs of the drug affecting the retina because of your treatment can be detected by directly viewing it and by the test that I told you just now, OCT. So, if you have rheumatoid arthritis, certain drugs that we use can affect. So, we usually get a 3 monthly testing done because a person is on that particular drug.
Right. We have a question from Kamna Kapoor. I'm pre-diabetic, but doctor says that I have scar marks in my retina. This happens due to some hurt in my eyes. Now at the age of 63, I have started having water in my left eye. Can it be due to my pre-diabetic condition?
Pre-diabetic condition, the sugars will usually be in the range of 5.7 to 6.4. It depends on how many years of pre-diabetes you have. Generally, it is 4 to 5. If you are a person with gestational diabetes, again, it will be 5 to 6 years, which is pre-diabetes itself tells you the sugars are on the lower side. So the blood sugar raise causing retinal damage or clogging of the blood vessels does not happen. The scars on your retina is because of something else, possibly some solar burn or some other issue, or could be some chorioretinal scars, which are some old inflammations, not related to diabetes.
Right.
What was the second part of the question? I'm sorry, I didn't get it.
Uh, I've started having water in
Watering.
my left eye.
Yeah,
Left eye.
watering in the eyes again, not because of diabetic retinopathy, but diabetes can impact not just the retina, it can impact the lid, causing clogging of the glands in the inside the lid. This is the upper eyelid. There are perpendicular glands on the eyelid that can get clogged. Those are called meibomian gland dysfunction. Generally happens in diabetics. That can produce a lot of disturbance, nuisance more than a major problem, and that can cause watering. Watering can also be because of some glass issues and things like that. You'll have to go to the nearest ophthalmologist to sort it out.
Uh, yeah, thank you, doctor. There's a call. There's a message from Omi, who's not mentioned her or his age. Doctor, in my right eye, I can read a line which is slightly wavy. but the left eye, there's no problem. I have no diabetes. What could be the reason for this?
You'll have to check your retina, you'll have to check your vision.
Right. Um there's a question from Anil Singh. Can surgery completely remove blood and scar tissue?
No. By the time you reach a stage of surgery for diabetic retinopathy, it has reached the end stage of retinopathy, destroying the vessels which are there in the center, and also the normal structure or the normal architecture of the retina, which caters to a very good vision. So at this point, it will not reverse back to normal structure again.
Right. Doctor, there's a question from Sushma Agarwal. I'm trying to, figure what it's saying. मैं मेडिसिन एमिरल 1 mg एंड डोप्लो 1 mg राइट है क्या मेरा शुगर HbA1c 6.5 है if she has a HbA1c of 6.5, is there a worry that she should have about retinopathy? I guess that's what the
Yes, so the thing is, she's reflecting 6.5 tells you a 3 month average. The current sugars also should be normal. So we don't look at only one parameter of HbA1c being 6.5. If her fasting is, say, 196, she's not under control. Because it's mango season, generally people show the 3 month average as 6.5 and the fasting would be 196. And they feel that everything is hunky dory and they can go on eating some more mangoes and nothing will happen. So that is not all right. And if your retina, if you feel it's also all right, it is better to get it checked by an ophthalmologist who does a complete examination and says that everything is fine, even if your
since you
vision is fine.
since you mentioned mangoes, what are the no-nos for consumption? Uh, for I guess these are general advice, but specifically for
Yes.
the eyes, what would you advise?
Oh, so there's nothing like more carrots for the eye because you have diabetic retinopathy. And there was few questions even from my what do you say, my patients who ask me, what should I do for eye care? How will I get some, what exercises should I do to get back to normal eyesight and stuff like that if I have diabetes? So it's basically, if you have diabetes, if you have uncontrolled diabetes, the first and foremost thing, if you have diabetic retinopathy to top it, if the first and foremost thing, even before we treat diabetic retinopathy, is to get the sugars under control, the blood pressure under control, and cholesterol under control. So we call it A, B, C of retinopathy treatment. A for A1C, B for blood pressure, C for cholesterol. So there was a person who asked, blood pressure can also lead to retinal damage. Yes, it can. So blood pressure can also clog up your vessels. So also your diabetes can also clog up your vessels. It's like a double whammy. If you have sugar and blood pressure, both can lead on to causing damage to your retina. So it's better to control blood pressure, sugar, and your cholesterol.
Right. Uh, Doctor, I think we've asked most of the questions. There's some question about puffiness under eyes. Is that anything linked with retinopathy?
If the puffiness is equivocal, that is, it's equal in both the eyes, it could be not because of diabetic retinopathy, it could be renal disease. It could be a beginning of a renal disease, water retention, which can lead to puffiness around your eyes, around your legs. Or it could also be water retention and something to do with your heart.
Right. Doctor, there's a question from Anil Singh. How often should one person with diabetes do an eye checkup?
So I already mentioned at the onset of diabetes, you should go undergo an eye checkup. If you do not have any diabetic retinopathy detected at that particular point, an annual checkup is mandatory for everybody. Don't go by, if you do not have now, it is not that you will not develop later. A yearly checkup is a must. At the very outset, if you are detected to have a particular stage of retinopathy, let's say it is non-proliferative diabetic retinopathy, if it is very simple, few hemorrhages here and there, a 6 monthly check will be good. Even at moderate stage, when you have those yellow lesions, a 6 monthly check is good enough. If your sugars have always been out of control, you do not have proliferative diabetic retinopathy, he has not suggested any treatment, 4 monthly check is good. These are American guidelines. Our Indian patients don't present themselves very faithfully. Most of them, some of them do. And proliferative diabetic retinopathy requires close monitoring, almost monthly if you're undergoing treatment. Proliferative diabetic retinopathy will not reverse on its own. Jadoo nahi ho jata hai. Your sugars will come down. Your damaged blood vessels do not open up themselves and start circulating blood everywhere. So don't be under that impression. If the damage is much severe, please do undergo the retinal checks. Don't be scared of it. It is to retain the vision that you have.
Doctor, three more questions. One is from Mr. Satish Kalia, who's 80. He says, can diabetes also result in glaucoma? You touched upon it, but just to reconfirm.
Yes, so diabetes itself will not produce glaucoma, but however, diabetes is a risk factor for glaucoma. What is glaucoma? It is a raised eye pressure similar to the blood pressure within the body. We all are aware and we know about blood pressure inside the body. Similarly, we have an eye pressure inside the eye, which should be between 10 and 21 millimeters mercury. If it goes higher, unfortunately, people do not have symptoms about it. So also, diabetic retinopathy does not have symptoms. So it's always better to check your eye pressure, the condition of your retina when you have diabetes. Nowadays, in most of the clinics, they all do eye pressure check, whether it is a young person or an old person. We all do a NCT or a non-contact tonometer where we put in an air puff and check a rough eye pressure. And if required, we go on further checking your eye pressure and related tests.
Right. Thank you. A question from Sunita Verma: steroid injections or anti-VEGF injections, which are better for diabetic retinopathy?
There's no right and there is no correct answer to that. If you have undergone a cataract surgery, we can give you steroids. If you have not undergone a cataract surgery, we cannot give you steroid injection. We'll have to go by VEGF injections only. If you give steroid injections in the presence of a clear lens, we will produce cataract. All of us know that. All the doctors also know that. That's the reason why all the patients do not get suggestions of steroid injections.
We have time for just one more question. Doctor, if one is not able to see, or one is not able to see with enough, with low light, is there any reason for worry, or is there a possibility of diabetic retinopathy?
In low light, if you're not able to see, is there a worry of
Yeah, and then
diabetic?
if you need more powerful light, is there a need for worry?
No, that is just aging, I guess. If your eye is all right.
All right. Great. Thank you very much, Dr. Savita Bhat,
Thank you so much.
for a very engaging session. We've answered quite a few questions today. And as always, it has been a delight to have you for this session. And I'm sure we've clarified a lot of doubts. There are some diabetes related questions which we haven't answered specifically, because I know the issue is ophthalmologist, but people, when they see somebody from a hospital like Chelarams, they obviously want the questions to be answered. But
Yes, there's some questions on Monjaro and all. I can see it on the screen.
What's your view on Monjaro?
Oh, on Monjaro, we have a complete testing done before we subject the patient to Monjaro. We advise them. We have a clinical team which tells you what all you should be doing. We check their weight, height. Other than all that, we also undergo eye testing before we put them on Monjaro. So that is a must. Not everybody can go through Monjaro. And if you want weight reduction, yes, Monjaro is the answer.
Great. Thank you very much,
Thank you so
Dr. Bhat,
much.
for this session, and thank you for taking your time. We will be back once again next Saturday at 5 p.m. But before you go, I'm going to just request our producer to play a video of the latest issue of Seniors Today, which is just out last Sunday. And Doctor, we publish this magazine every 15th of the month. And
Yes.
it's just, yeah, go ahead, Feroz. Clint Eastwood at 95 and still very active. That's the inspiration for many of us. Thank you very much, Dr. Bhat, again.
Thank you so much. Thank you. It's
And
been wonderful being here.
we would love to have you once again, not too long away, and
Thank you.
meet you in person as well. Thank you.
Yes, sir. Thank you so much.
Thank
Thank
you.
you. Jai Hind.